In threat assessment, how do professionals separate a long-term vulnerability from an imminent attack? Treating every troubled student as an active threat is impossible, but missing a real escalation costs lives. Take a socially isolated student with a history of discipline problems who suddenly starts obsessively researching firearms. That background, isolation, and discipline history create a baseline vulnerability. Assessors call these risk factors, conditions that elevate the overall probability of violence over a long time horizon. But millions of people live with social isolation without ever harming anyone. Risk factors alone don't justify an emergency response. But that sudden firearm search, that shows active, time-sensitive preparation. That is a warning sign, a dynamic behavior that demands immediate intervention. The two work together. Warning signs dictate exactly when to step in, while the underlying risk factors determine how dangerous the situation is, because the baseline is already elevated. Fortunately, positive forces, like a supportive mentor or active therapy, act as protective elements, actively counterbalancing the threat and lowering that overall pressure. So when our student searches for weapons, the system knows exactly how to respond. The warning sign triggers immediate safety protocols, while those underlying risk factors guide the long-term counseling they need to recover.